This is my final presentation, and the population that I've chosen to cover is post-traumatic stress disorder. I've chosen this for a couple of reasons. Primarily, I come from a military family with my grandfathers, my father, my uncles, and my brother all being involved in military work in some way. The pictures that you're seeing are my family. The woman in the dress and dark glasses is my cousin, and her first husband was a Marine who was killed in Afghanistan in 2005. She has since remarried another Marine who served in Afghanistan as well, and he has suffered from some elements of PTSD, so I thought I wanted to discover more about it and kind of understand what he's going through. Military members are not the only people who suffer from PTSD, though. It can affect individuals who have suffered from natural disaster in their area. Anyone who has had a life-altering accident, whether it's a car accident or an accident on the job. PTSD also is common in public servants like firemen and policemen who see tragedy every day. And finally, anyone who has experienced abuse, whether physical, emotional, or sexual, can suffer from PTSD. According to Regal and Joseph, post-traumatic stress disorder is the term used by psychiatrists to describe reactions that cause clinically significant distress or impairment in social, occupational, or other important areas of functioning in people who have experienced a traumatic event. It's not talking about a regular reaction. It's something that has impacted every part of a person's life and is making difficulties in just going about day-to-day functioning. Another element of the definition comes from Myers, and he says that post-traumatic stress disorder is an anxiety disorder characterized by haunting memories, nightmares, social withdrawal, jumpy anxiety, and or insomnia that lingers for 4 weeks or more after a traumatic experience. Some of the symptoms are listed in the DGT book that we've been studying, and it can include flashbacks, memories, difficulty sleeping, unintended memories, feeling disconnected, or a lack of feeling or emotional numbness. Another symptom that's cited there is easily being startled. Populations that are affected by PTSD don't have a lot of strict boundaries. It can be any age, any ability level, any race, any occupation. The common populations that we hear about are soldiers, victims of abuse or accidents, and victims of war or natural disasters. And this information comes from the National Institute of Mental Health. DGT points out that a cause of PTSD is an exposure to a terrifying event or ordeal, such as violent personal assault, natural or human-caused disaster, accidents, or military combat. The diagnosis of PTSD is done by a clinical professional. If symptoms persist for over a month, and usually present within 3 months after the trauma. Sometimes there's a delayed onset for these symptoms, but usually it's pretty close to the time of trauma. After sitting down and having a discussion with the patient, the clinical professional is going to look for these symptoms. Some sort of re-experiencing, which could be a flashback or a nightmare. 3 symptoms of avoidance: guilt, worry, emotional numbness, blocking of memories, and avoiding any sort of physical reminder or social reminder of that trauma. And 2 hyperarousal symptoms. These could be tension, anger, jumpiness, or any sort of difficulty sleeping. Often victims of PTSD will have depression, substance abuse, or other anxiety disorders combined with that PTSD. Traditional therapies for PTSD often include group or individual talk therapy, and the average duration is 6 to 12 weeks. It could last much longer than that, though. Some of the ideas used in traditional talk therapy could be exposure therapy, facing the fears or the stimulus that causes fear and learning strategies to overcome that in a safe environment. Cognitive restructuring, which is trying to look at that trauma in a realistic and factual way instead of an exaggerated way or a way that places guilt or blame on the victim. Stress inoculation training, which is learning to deal with any anxiety in a healthy way, thus being able to overcome the stimulus that is causing the stronger anxiety after trauma. Traditional medications include Paxil and Zoloft, which are antidepressants. There also are studies that point out antipsychotics and sleep aids or other kinds of antidepressants like Prozac. There's also some research that points to medical marijuana, and certain states have started to legalize marijuana for PTSD victims. When looking at music therapy, there's a lot of research that focuses on veterans, so that's where I started. Benjamin, Amir, and Wolf look at drum circles and how that can create a sense of unity, even while each person has their own drum and their own pattern and their own playing style. The entire group is working together, and even if no one in the group worked together in the military, they can create a sense of unity and bond together over drumming, and then that can relate to some of the discussions that are going to be held after that drum circle has ended. Later on in that study, pointed out that the sense of openness and intimacy was increased after playing together. They were able to share verbally. Also noted were the moments of experiencing memories without a threatening environment. They felt safe. And there was the physical release of rage after playing the drums. Oftentimes the drums were played at very loud volumes, and it was a way for the participants in the drum circle to get out some of the anger and aggression that they were feeling, cathartic release. Later on, the same three authors got together and did another study. It used some of the same research, but it also expanded on that. And they talked about improvisation with lots of different instruments instead of specifically with drum circles. And it found that instrument choice was huge with victims of PTSD. They chose wooden instruments over metal instruments because they felt they were more relaxing, and the metal instruments often brought back negative feelings or emotions and created some tension. I thought it was important to note that as we're working with victims of PTSD, the awareness of what instrument brings up what memory is going to be a huge part of how we structure our therapy sessions. They also talked about listening to relaxing music, and at the close of sessions would spend 10 to 15 minutes trying to create a relaxed state of being, and then working on how to get to that relaxed state of being and how to come out of that relaxed state of being. This had some mixed results from the veterans who were in the group, and some of them said that was the first time they were able to feel relaxed, while others said that they never were able to reach that place. Some of the music used in that was Reiki, and this is what that sounds like. Now I'm going to move into a different population or age group of people affected with PTSD. Li, Lin, Chiang, and Wu looked at a group of children who had experienced an earthquake in Taiwan, and they found that through dance therapy, the children were able to act out some of the traumatic things that they had seen and create a more full understanding of what was happening. The children started by simply playing games and dancing to music, And as the day progressed, the children started to recreate some of what they had seen in the earthquake aftermath, the deaths and coffins, and the children started to recreate burials. And this is my coffin, come and join me. My coffin's big, there's lots of room for us. And as they were doing this, they were working through some of how they felt about the death that they had seen after the earthquake in Taiwan. I found a manuscript that hasn't been published yet from Laura Pierce, and I chose to put it in here because I thought it had some awesome information about victims of sexual abuse and how music therapy and dance and movement therapy had helped them. The first thing she points out was how with victims of sexual abuse who are suffering from PTSD, it's important to have a trusting relationship. And by building rapport and giving the client a lot of control in how fast things are moving and exactly what kind of things they're doing, it could create a sense of safety and trust with that client so that they felt comfortable moving forward. She also points out that through the use of dance and movement therapy, several goals could be addressed, including self-esteem, body image, and the reestablishment of trust. Anyone can be affected by PTSD. Trauma happens to everyone, and where there is trauma, there's a possibility for PTSD. It's not limited by age, gender, or occupation, and the symptoms can vary widely among clients. Music therapy can offer a variety of treatment options for any individual suffering from PTSD. Thank you very much for listening. Here are my references, and have a great day.